Hello everyone, today we will see the osteology of the mandible. So mandible, it is one of the strongest and the largest bone of the face, and it is only movable bone of the skull. It mainly develops from the first pharyngeal arch, and when you see the shape, it is mainly the horseshoe shape. Coming to the parts, when we see in the mandible, it has got the body and the ramus. So this is the body of the mandible, this is the ramus of the mandible. So first coming to the body, when we see, it has got outer surface, inner surface and upper border and the lower border. So upper border is also known as the alveolar border, lower border also known as the base of the mandible, and outer surface, first we will be seeing the outer surface. So when we see in the center where both the body of the mandible are meeting, this part we call it as the symphysis mentae, and this protuberance is known as mental protuberance. Sometimes lateral to that we can see the tubercles, which we call it as the mental tubercles. Next to that, immediately just laterally, there is a small impression just below the incisive teeth will be there, that we call it as incisive fossa. Immediately lateral to that foramen, what you are seeing is the mental foramen. Then there is an oblique line, which is nothing but you can see the continuation of the anterior border of the ramus of mandible continues as an oblique line on the outer surface of the mandible. So these are the features on the outer surface. Coming to the inner surface of the mandible, that is the body, you can see along the posteriorly behind the symphysis mentae, tubercles are there. So these are the superior genoid tubercle and this is the inferior genoid tubercle, and behind that there is a small impressions, two impressions are there, though this is the digastric fossa. Here line what you are seeing, this is the mylohyoid line. Just above that, the shining area, this is the sublingual fossa. This below shining area fossa is the submandibular fossa part. Okay, so just below the mylohyoid line, what you will be seeing is the groove, that is the mylohyoid groove. Coming to the ramus, so when we see the ramus of the mandible, it has got four borders: anterior border, posterior border, superior border and the inferior border. Two surfaces, that is the lateral surface and the medial surface. So first we will see the medial surface. When you see in the medial surface, there is a rough area on the posterior inferior side, that is nearer to that you will be seeing the angle of the mandibles, that is the posterior border and the base of the mandible together form the angle of the mandible part, and this foramen is the mandibular foramen. Just above that, the tongue like projection, we call it as the lingula of the mandible part. Next, coming to the processes, two processes what you will be seeing. This is the coronoid process of the mandible, this is the condylar process of the mandible. Coronoid process, it is triangular and sharp, and condylar process, it has got head. So this is the head of the condylar process, and this is the neck part, and this is the mandibular notch, which is nothing but the superior border of the ramus of the mandible. Along the anterior part, so this will be the anterior border, and behind posterior border it is more thicker in comparison with the anterior border of ramus of mandible. On the outer surface you will be seeing the rough impressions on the outer surface, that is posterior inferior part. The rough impressions is seen along the ramus of the mandible. Now coming to the muscle attachments, one by one we will be seeing. So in the external surface, that is the outer surface of the body, just on the incisive fossa, that is the mentalis muscle, will take origin, and the few fibers of orbicularis oris also will take origin here. And in this oblique line, from medial to lateral, three muscles are there: depressor labii oris, depressor anguli oris, and still lateral to that will be the buccinator muscle. Coming to the base of the mandible. To complete base, including the lower border of ramus of mandible, whole of the part will give attachment to the deep cervical fascia of the neck. Along with that, platysma is also attached here. Now coming to the inner surface of the body, along the mylohyoid line is the mylohyoid muscle will be attached. In the digastric fossa, anterior belly of the digastric is attached there. Genial tubercles, that is superior, will be the genioglossus muscle, inferior will give attachment to the geniohyoid muscles. Just at the posterior end of the mylohyoid line, the superior constrictor of pharynx will take origin here. Okay. Posterior inferior angle will give attachment to the medial pterygoid muscle. Near to the neck of the mandible, that is condylar process, below that is the pterygoid fovea, which will give attachment to the lateral pterygoid. Along the coronoid process, upper part, apex and the medial surface will give attachment to the temporalis, and the outer surface of the ramus of mandible in the lower part is masseter muscle will be attached here. In the upper part, the parotid gland will come in relation. So, 3 glands are coming in relation with the mandible. In the upper part of the ramus of the mandible is the parotid gland. Below the mylohyoid line is the submandibular gland. Above it is the sublingual gland. Ligaments, when we see, to the lingula, that is the sphenomandibular ligament is attached. Then at the angle of the mandible, that is stylomandibular ligament, and behind the third alveolar process here, the pterygomandibular raphe will be attached here. Okay. So next we'll see the foramens. So mental foramen, through this the mental vessels and nerves will come out. Next, coming to the mandibular foramen, the inferior alveolar vessels and nerves will pass through this. Below that is the mylohyoid groove, where the mylohyoid vessels and nerves will be passing. Just above the mylohyoid line, it will come in relation, that is the lingual nerve will come in relation here. Along the mandibular notch, mesenteric vessels and nerves will come in relation. Nearer to the neck of the condylar process, the auriculotemporal nerve and the superficial temporal artery are related over here. Okay. So coming to how to hold the mandible in anatomical position. So the ramus of the mandible should be facing, that is the condylar process and the coronoid process should be facing above, and both the, that is body of the mandible should be facing in front, base of the mandible should be below, and the alveolar process should be facing up. This is the anatomical position how we will be holding. So coming to the age changes of the mandible, when we see in the children's mandible, the mental foramen will be in the lower part, it will be shifted in the lower part. In the adults, it will be exactly in the center. In the old age, the mental foramen will be in the upper part. Okay. And when you see the angle of the mandible, this is the angle that is between the anterior border and the alveolar process of the body of the mandible. So it will be obtuse angle, and in the older age it will be about 140 degrees, whereas in the adults it will be about 100 to 110 degrees here, and in the children it is again same obtuse, that is 140 angle will be there. And the third part what we can see is the alveolar process. In the older age, the alveolar process will be becoming completely smoother in the old age, and we can clearly see the alveolar processes, that is the attachments of teeth in the adults, and even in the children it will be present.